So we are going to go ahead and get started. Good morning, everyone, and welcome to the webinar, How a Dentist Can Help Save Your Life. Dentists are more than just cavity hunters. Thrilled that you can be here with us today. My name is Elizabeth Aloni, and I'm with Schneps Media. Schneps Media is the largest local media company in the New York metro area. We publish over 80 newspapers, magazines, websites, webinars, podcasts, and events throughout Queens, Brooklyn, the Bronx, Manhattan, Westchester, Long Island, the East End, Philadelphia, and even Palm Beach, Florida. But today we are thrilled to be here with you and have the privilege to hear from a renowned dentist to learn about the hidden dangers in your mouth and how to prevent oral cancer and the serious implications of the disease. So let me get started right away with introducing our illustrious panelist, Dr. Parul Dua Makkar. We are so thrilled to have you here. Dr. Makar completed her Bachelor of Science from the University of Central Oklahoma in 1999, magna cum laude, and then DDS from University of Oklahoma College of Dentistry in 2003. She practiced in Calgary before moving to New York. Here, she completed a GPR training at Staten Island University Hospital and has been in private practice since 2007. Currently, she's the owner of PDM Family Dental on Long Island, a place she resides in with her husband and 2 boys. Dr. Makkar's life took a different trajectory when she lost her only and younger sibling, a Calgarian dentist, Dr. Manu Dua, to oral cancer in March 2021. Since his death, she devotes her time educating doctors and patients alike about risk factors, prevention, and advocating for early diagnosis of oral cancer. She's co-authored several dental journals, has been presenting lectures to dentists, and has been a guest at several podcasts besides her own podcast, Life Interrupted, Dr. Dua's Survival Guide podcast companion. She believes oral care is the gateway to overall well-being and aims to have open conversations with her patients. She's a recipient of the Denovi Awards 2022, as well as Long Island Excellence in Healthcare 2022, and a Power Woman of Long Island in 2022. Dr. Makar is also being honored as a healthcare hero on May 18th by Schneps Media. Looking forward to that. She's also co-authored the book Life Interrupted, Dr. Dua's Survival Guide, which is a winner of the Best Inspirational Motivational CPA Evie Award. Wow. Welcome, Dr. Makar. Thrilled to have you here with us today.
Thrilled to be here. Thank you so much, Elizabeth.
Absolutely. So I touched upon it a little bit in your bio, but I want to get started personally. And although you're a renowned dentist, your personal meaningful story really fuels your passion for oral health. Can you share your story?
Sure. So my younger and only sibling, he was almost 8 years younger than me. He was diagnosed in 2019 with oral cancer, and Manu followed my footsteps, and he was a dentist himself in his early 30s and, did not think cancer would affect him, because when you're 30 and you're starting a practice, you're busy living life and you've achieved so much and you worked hard, and that's the last thing. And unfortunately, he was diagnosed with stage 2, and he had a 8-hour surgery with a team of vascular surgeons, ENTs, oral surgeons, plastic surgeons, and he had half his tongue removed and a graft placed from his arm, and major surgery, which he recovered well from, and he actually came to New York. He flew within 2 months. Unfortunately, the cancer returns because it's such an aggressive cancer. And he did undergo rounds of chemoradiation after another second surgery. And unfortunately, things just took a bad turn. And when he was diagnosed for the second time, that was during COVID. He was diagnosed second time in April of 2020. And that's when COVID had hit and everybody was trying to navigate this uncertainty that Manu went through this. So it was very hard, challenging to go through the process with elderly parents, and as well as with borders shut down. I reside in New York and he was in Canada. So it was the worst of news and the worst of circumstances and the worst of conditions. And it was a tough. And unfortunately, I didn't get to say goodbye to him in person. he was in palliative care towards the early of 2021. And because of the borders being shut down, I had to get a PCR test. And with time being of an essence, I didn't get it in time. And I had to say goodbye to him on a video call, just like you and I are. And I had to say, you have to let go and it's fine. And you don't wait for me and you're done suffering. If you want to go, go. And I'll come when I can. And I made it a day late. So, and after that was the aftermath of cancer. And so my journey, yes, this cancer can affect anyone and we'll go into it, but, cancer just doesn't affect the one person who has it. They're suffering, they have their scars and they have their rounds of surgery, but it's the family who watches from the sideline to understand how devastating it is. And even though the person may not be with us, the void that cancer has created, it's still felt. So cancer still affects us to this day.
Absolutely. And God bless you. You really took a tragedy and you're turning it into advocacy. And that is, a tremendous blessing and really a beautiful way to honor your brother. So thank you for sharing that. I mean, obviously, based on your story, it's very clear that oral cancer is not just something that affects the older population. So what can you tell us about that, about age and oral cancer?
Sure. So cancer really can affect anybody. And I think that's a misconception, especially with oral care or oral cancer. We in the past have associated oral cancer with somebody who's a heavy smoker or a heavy drinker. And, traditionally it's been like older male, pipe smoker maybe, or chewing tobacco. But cancer really can affect anybody. And it's been on the rise in the last few decades because of the human papillomavirus, which is called the HPV. And, it's something you can contract even when you're younger and as soon as you become sexually active. And it clears your body, but it's there and it can become cancer. And so it doesn't just affect that one person. It affects knowing your history, knowing if you have cancer in your family, that predisposes you to any form of cancer, essentially, but even with oral cancer, having a poor nutrition, poor diet. So it's a lot of things. It's knowing your risk factors. Have you had cancer before? Have your family members have it? It's just like with any other cancer, having good familial history. And then also knowing your own risk factors, your lifestyle choices that affects it. So don't think that, what I do may not affect me because I'm young and I'm healthy. It really can, and it just has no bounds, and it does not have any, it just doesn't discriminate with age or gender or social status or education status or any other factors. Yeah.
So are you seeing an increase in oral cancer? What is happening in the grand scheme of the disease?
Sure. So there are about 54,000 cases being diagnosed annually in the United States at this point. And of these, a fourth of them are diagnosed under the age of 55. So these young people, in their 30s, 40s, 50s are getting cancer, and that's because of the human papillomavirus. And the human papillomavirus is the same virus that is being tested for when women go for their pap smears. So if, let's say, a woman gets tested positive for HPV when she goes for her pap smear, then her partner needs to be a little bit more wary of having HPV-related cancer. And this cancer is, the HPV-related cancers are can be treated easily preventatively by getting a vaccine in your early teens or preteens by your pediatrician. So there are many different factors. And there are different strains of HPV, but the ones that are affecting us are HPV 16. That causes the oropharyngeal cancer, which is the cancer of the throat and the back of the mouth. And cancers which are more related to smoking, chewing tobacco, they're more towards the front of the mouth. So there are two different forms of cancers, front and the back, and the cases are increasing because of the human papillomavirus.
So is there a way to, so obviously, I mean, it's too late for me. I'm not a teenager anymore. But is there, is there a way to prevent HPV other than the vaccination?
So Gardasil is the one that is produces the vaccine for it, and or actually, Merrick is the company. Gardasil is the vaccine, and it's Gardasil 9, which protects them from 9 different strains, and it is approved for anyone from 9 to 45. So not necessarily if somebody's older. Yes, you can get the vaccine. It won't, if you have the virus in your system, it won't prevent you from taking that out, but will prevent you from getting new infections.
Okay.
And once you contract HPV, it's not a big thing. Usually it clears in your body between 1 to 2 years. But for some reason, some people are just more susceptible and they have a different genetic makeup. And for some reason, their cells do tend to multiply and get it. So can somebody who's older get it? Yes. Is it as effective as getting it when you're younger? No, it's better when you are younger in age. Ways you can prevent it is, practicing safe sex. It's also like using how many sexual partners do you have? It is the most sexually transmitted disease right now, more so than STDs, according to the World Health Organization. So just how you would practice safe sex with STDs, you would protect yourself also from HPV.
Very important information to share. What, in going to the dentist, what should I be asking my dentist? Many of us go to the dentist, you think, oh, teeth cleaning, oh, cavities, but what should I be speaking to my dentist about to make sure that that this is something that can be addressed and found as early as possible?
One thing is not being in denial. We all know our bad habits, right? We may not want to admit it to others, but what I'm talking about is, how much you're smoking. You may not want it. And, we all kind of lie a little bit when we go to, yes, do you smoke? Yeah, I have a cigarette. They may be smoking half a pack a day, but you really know yourselves, your bodies. So, know of the risk factors, know that smoking, vaping. Vaping that contains nicotine is banned in Australia as of October because it's so carcinogenic. And, our young teens are vaping. Middle school, high school kids are, because it's more socially acceptable than smoke because it's of the smell and it can be put in anywhere. So, and we know vaping is a rise in teenagers. So when you're going to the doctor, know how much alcohol consumption you're having. Are you chewing tobacco or are you smoking a hookah? Some people think that smoking a hookah is not a big deal. It's not real smoke because it's not a cigarette you're holding in the mouth and you have this pipe, but you're getting a longer exposure to the nicotine and it's carcinogenic. So know your risk factors. And, tell your doctor, like, hey, I have a history. I do these things. If you notice something, have them check out. Sometimes, we miss things and you can tell your doctor, I feel a lump. What do you think? Or I've had this lesion that I think, or, some soreness in my throat that isn't going away and it's not related. Like, be honest and have frank discussions. We're not judging. We're just here to help you. And know of your lifestyle choices and make wise decisions as far as being honest with them and seeking the care when you think that something is wrong. When you're in the chair, teeth are related. We're not just checking your teeth and saying, oh, it's okay. You may see your dentist, like, look underneath your lip, feel around your throat, have them move from side to side, ask you questions, have you stick your tongue out. And we're looking for other things besides just, oh, you have loose teeth, you have a buildup, you have cavities. There's more to it.
Absolutely. As we were reading in your bio, it's the gateway to your body, your mouth is. And there's been so much information about how much your oral health affects your overall health.
Absolutely.
And people need to understand how critical it is and what an important component the right dentist is in making sure that not just your mouth is healthy, but your heart, your body, your all the different pieces of your health. And you
Absolutely.
mentioned about keeping an eye on it. Could you share a little bit more about what are some of the symptoms we should be concerned about?
Sure. So some of the symptoms are any sore in your mouth. Let's say you were eating a hot pizza you burned, or you brushed wrong and you got a little cut, bit into a Dorito chip and you scratched. Any of those things, like any soreness in your mouth, should go away. Or you have a cold sore, you have a herpetic lesion, anything should heal within 2 weeks. Painful or non-painful, doesn't matter. If you see something in your mouth that hasn't healed, and it could be on your tongue, it could be on your palate, which is the roof of your mouth. It could be under your tongue. So if you're pulling your tongue out and you're like, it kind of feels weird. And cheek, you may have bitten your cheek and now you have like this irritation area. Anything should heal within 2 weeks. If it doesn't, bring it to attention. That's one thing. Also, like if you stick your tongue out at home, just like that, if it deviates to one side, like you're moving to one side more so than the other side, that maybe something is growing in the back of your throat and you want to highlight that. If you feel any lumps, just like you would do a breast exam at home and you're looking for any lumps or bumps, men and women, just like that, if you feel anything on one side of the body, not both sides. If it's more unilateral, only one side of your body, that's a cause for alarm. If you have any soreness or like difficulty swallowing or like hoarseness, you're constantly coughing and it's not related to any other condition and it's not going away, it's just getting worse, that may be a sign for you to come. You're having difficulty chewing, talking. And again, nothing has to hurt per se. Like a cavity doesn't hurt until it's grown bigger and it's into the nerve chamber, and that's when it starts hurting. And same thing with cancer lesions. Sometimes they're non-painful unless they've gotten so big and now they're in your lymph system, they're starting to travel and it's starting to get more aggressive in nature. So kind of be aware of your body. You know your body, that if something doesn't feel right, bring it up, talk about it and say, hey doc, last couple of months, this feels really weird. I know it wasn't there in the last 6 months I saw you, but I noticed something and it's kind of grown in size. I feel odd about it. What do you think it is? And if it's been there for a long time, push for a biopsy, because the earlier the diagnosis, the earlier we know what it is, the better we can treat it and more conservatively we can treat it. Like in my brother's case, he had a small tongue lesion. It could have been taken away rather than having half his tongue removed. I mean, that's a pretty considerable surgery. And so, the mouth is so close to all these other vital structures. We're not far away from the brain. So we're not far away from the heart. The lymph system is right here. So, and cancer spreads from the lymph system, it starts through the blood vessel. So the quicker we can diagnose and get the treatment, the longer and better prognosis of the patient, because this cancer is, in 5 years, it has like a 50% mortality. And the higher the stage of cancer, the mortality rate, drops like this. So it's so essential.
Phenomenally important. So how often should, first of all, how often should we be looking for ourselves doing screening? And then how often should we be screened by our dentist?
So screening, I mean, I would do it once a week, or if you're in the shower while you're doing a breast exam, you can kind of feel, or when you're brushing your teeth, just take a look and say, oh, does everything look fine? If you, move your tongue around from side to side, make sure nothing, back of the throat, all this whole area above the neck, you don't feel anything, bumps. It's a very simple check. And there's screening cards. It's on my website. But it's easy to check. And it's something, even if you're in the car and you're like, oh, that's sore that I thought it's on the roof of my mouth. We have cameras, we have pictures. It's so easy to do this right now. And if you see something, you can just send it off to your dentist, like, hey, I got a picture of this. Do you think I need to come in for it? And it's quick and it's easy. The unfortunate part about oral cancer is there's no true diagnostic test to screen for it. Like you have for colon cancer, you get a colonoscopy and you're looking for stuff. You go for pap smear and you get tested for it. There's no test unless it's all tactile, it's all visual, it's all knowing your signs and symptoms, knowing your risk factors. It's coming in and getting a biopsy. And that's when real test, that's when we send out to the ENT to get more results until we have an affirmative biopsy. So there's no true diagnostic test for oral cancer. And that's the unfortunate part.
That is unfortunate. That really goes to show how critically important it is to be speaking, with your dentist, to be making sure that you're checking yourself, because this is something that can easily be missed. What should I look for in a dentist? Because I don't, when I think about when I went to the dentist, I don't know how much attention was given to these things. I mean, obviously you are opening up the conversation and, I'm going to go to the dentist in a very different way now. But what should we look for in a dentist to make sure that they are taking care of my oral care beyond cavities?
Sure. So usually the dentist during the oral exams, it's, whenever you come in for your cleanings, for your 6-month cleaning, the dentist should be literally like taking your lip and lifting it up, both upper and lower, having you move your tongue out side to side, feeling around. When I do an exam, I have them feel all the way around here, underneath the chin. I go inside the tongue, like not inside the tongue, but I have them lift their tongue up and put my fingers on the bottom right of the cheek, and then feel for any bumps, because this is all a lymph node system here. I have them move their neck from side to side, and I hold this band, a muscle that you have here, and I feel for anything that feels odd, and I'm feeling down the clavicle, the neck area here for any lumps or bumps and I am asking questions. Have you noticed anything different? Do you feel anything different in your throat? I've had patients who've said, yeah, when I swallow, it feels really, but it's only on the midline. All right, let's have you go for an endoscopy, because these are things I cannot visually see. Right. So I'm like, okay, if you're feeling this and it's been there for a while, do you have a cough? No, I don't. But, it just like irritates. Go to the ENT and let's get an endoscopy in and let's just check it out. Because I'd rather you get the biopsy, pay a few extra bucks, than get a late diagnosis and really have very limited time to do all these treatments. So dentists should be looking and asking for these questions, especially if they're smoking and vaping. And another conversation that we don't necessarily have in the office is about getting the HPV vaccine with children. Unfortunately, people feel different ways about vaccine with their cultural beliefs or their religious beliefs, and especially with COVID, with vaccines. It's a hard conversation to have, but this is a conversation you can have with your pediatrician because the pediatrician will ask you to get the HPV vaccine for your preteens, usually around age 10, 11. And have those conversations with your pediatrician too. They will say, yes, it's advisable. It's a 2-dose. It's not something you have to get a booster for. And you get 2 shots and you're done. And you protect your children. And but the dentist should be asking these questions, should be doing this. Now, if there is a lesion that has been something that they see that warranties that, you need to come back, what I do is I always take pictures. I have an intraoral camera in my office, and I have a big screen that I can show patients. Like, look, this is what I'm looking at. I take a picture of this. I'm like, did you know you have this? It may be something on the roof of their mouth, behind a tooth, somewhere that's not very visual to the patient. And if it's not hurting, they won't know. And so I'm like, look, this is what I see. Here it is on the big screen. And we're going to monitor this for 2 weeks. Did you know of it? They may say yes. They may say no. And then I'll ask questions like, did you do something different? Did you hurt yourself? Did you, and I'll hear all sorts of stories. Oh, I was holding the pen and then I scratched myself, or I was holding my keys in my mouth, or I opened a bottle. I'll hear all sorts of stories, and which is fine.
Sure.
There's nothing that can embarrass me, and there's nothing that'll shock me. It's completely fine, but just be honest with it. And then you're being honest with yourself. And I'm like, okay, you know what? Just come back in 2 weeks. Let me take a quick peek at it. If it's good, and that'll be 5 minutes of my time. I don't charge for that, for another visit for them to come back to. It's just for me and the patient. It's for the betterment of the patient. Like, all right, if this looks good, let's take another picture. If it's gone, yay, good for you. And we're done. If it's not gone, here's a great oral surgeon. And I would either send them to an oral surgeon or an oral pathologist first. I will not send them to ENT. That will be a little bit more until we have a proper diagnosis. That's when they get guided. And, diagnosing and biopsies should not be like a scary word. Not necessarily are patients getting a biopsy necessarily mean they're getting cancer. It's just knowing what you have and how to appropriately treat it. Is it a bacterial thing? Is it a viral thing? Is it a fungal thing? Or is it trauma? Is it, from an ill-fitting denture, perhaps, or a broken tooth, and you're getting, and you're scratching your tongue, rubbing against a broken tooth? It could be so many different factors. You can have irritation trauma. So it's knowing what you have. That's what the biopsy is for, to treat it appropriately and guide you in the right direction.
Look, it's the unknown one should be afraid of, not the known.
Yes.
Because that's where you can get the treatment and you can get the help. I mean, I just speaking to you, I feel so much calmer about because look, I mean, knowledge is power, and that's, what you're giving all of us today. And I did actually share your contact information. Tell me a little bit about your practice.
Yeah, sure. So I have a private practice in Jericho. I started it from scratch and just before COVID. I'm there and I have a specialist that comes to the office. I see children and adults. And my practice, I really have a patient-centric practice. I don't focus on what the insurance is covering. Of course, we'll go over the options, but my dedication, or my first priority is to you as the patient. What brings you here? Patients may say, I haven't gone to the dentist since COVID. Fine. Oh, I have this thing that's bothering me. Fine. And then the patient comes in. The other day I had one. She's like, I got hit in the face. I can't open my mouth. I'm not going to sit there and, we need to do a full set of exams, and we need to do a full set of x-rays. And I'm like, all right, let's get you first for your joints to be in good shape. And once you're able to open, and then we'll go to your treatment. So it's knowing what brings you to my office. Your dentists are not the favorite people. Nobody likes coming to the dentist. I've realized that. And, so I try to make this a more pleasant experience. It's trying to get to what brings them and then what makes them happy. And presenting treatment options. Remember, they're always, different economic prices, different, where you are in your stage of your life, or where, what your comfort level is. Somebody doesn't want, let's say, a removable prosthesis like a denture, and somebody wants bridge work, somebody wants implants. And sometimes the option is to do nothing. And, not necessarily everything has to be treated right away. Not necessarily does every tooth need to be replaced. Not necessarily is it that everything needs to be veneered. If you have spaces between your teeth, go to the orthodontist first. Let's do something more conservative rather than putting you in all crowns. So it's knowing your patients, spending time with them. That's what I do, is what drives you to me. Why me? Why not somebody else? You came referred from somebody, you came from the insurance, you came from a review. And my whole thing is about patient care and educating patients. There are times I'll sit there with models and charts and diagrams and pull up stuff. I'm like, I want you to know what we're doing before we're doing it. And people will say like, oh, I need a root canal. Do I really need to do it? yes, if you want to save your tooth. You don't want to save your tooth, we can take it out and then we can discuss other options. But there's always, the patient has the choice. It's their body, their, autonomy. I'm just a guiding force, and I'm there to educate and provide care, which they feel best is for them.
Fantastic. Fantastic. Well, I did share your website. It's pdmfamilydental.com. It is in the chat, and I'm going to send it to everyone as well. But I also just want to brag one other second. Tell us about your book.
Oh, yes. So this is the book, Life Interrupted. I don't know if you can see
Move
that.
it in front of your face. Put it right in front of your face. There we go. Oh, there. Perfect. Yeah. Wonderful.
So this book, I wrote the foreword and the epilogue to this. This book is actually written, it's a series of blogs that my brother wrote, knowing that he had cancer, knowing that time was not on his side, knowing that he was fighting it for so long. And he talks about life lessons. He talks about not losing hope. He's like, tomorrow is not promised to me, nor is it promised to anybody else. But I'm just going to keep hoping for the best, whether tomorrow comes or not. He talks about the ability to endure, tragedies of our life, right? Like, if you look at everybody has faced some kind of adversity, how we're always given either we sink or swim. So the people who push through and get through the adversity, like, we have the ability to endure. It's our minds. He talks about cancer journeys, his, how he's accomplished so many so young, and he's achieved all these things, but at the end of the day, he is sitting alone in a hospital bed, and all of that doesn't matter. And it's all the people, the core, who are there for you at the end, they matter. And just having the ability to take a breath that we take for granted, that we don't even think about. So, and it's life lessons on immortality. Like, we're all mortal beings. We're all going to die one day. And we just need to accept that and not be scared of living because we're scared of dying. That's just going to happen. Nobody knows it. When you could be walking down the street, get hit by a car. So, life's really a gift. And to achieve immortality is to do something good for the humankind that you're remembered with. And that's how you achieve immortality. And so there are all these little chapters on it, and I helped complete it. I found his writings. I knew he was writing. He wanted to be published. We had found a publisher, and he's like, no, I got time. I'm going to write more. I don't want to stop writing right now. I'm going to continue. And unfortunately, the events happened so quickly. And when I went for his funeral, I got his laptop. I started reading. And I said, this can't be just stored away in a laptop, shut and put away. It needed to be shared with the world. And we already had the publisher. Everything was set. It was getting his word. And so we got it all together, and I helped compile it and finish it. And I write in the epilogue about how Manu became Manu and the aftermath of cancer, which is this loss that people who have traveled this journey will resonate with, that it affects you every day. So it doesn't go away.
Absolutely. Absolutely. Well, that's really beautiful. And what, again, like I said, you really took a tragedy and turned it into an empowering lesson that so many of us can learn from, not only as a dentist and protecting us from oral cancer and teaching us all the importance of our oral care, but also as a motivational speaker about the life lessons of a life cut too short. So really wonderful. I did share your book link, as well as you also have a separate website that's about the book and being a speaker. So everyone can join there too. I did share it in the chat, but I'll also share it via email. We're going to send out an email in 24 hours from now, so that you'll get that. You'll get the recording of this. So thank you so much. I do want to get to some of our questions. We have some great questions from our attendees. So let me turn to that. Robert wanted to know, can you speak to the role of alcohol consumption in oral cancer?
Absolutely. Everything in moderation. If you are drinking every day or binge drinking over the weekend, it increases your risk for oral cancer. It really does. So alcohol plays a big role in it. And how much alcohol, it's very hard to determine. Cancer is also depending on genetic factors, but definitely alcohol consumption is a higher risk for oral cancer. Maybe not a glass of wine every day, but if you're having like 2-3 beers every other day, or you go out drinking the whole night and there's a lot of drinking, or you're consuming it with a cigarette or maybe a pipe, that is all increasing your chances.
I actually learned some information that, it's like double-digit percentages of cancer related to alcohol use. So it's not just for oral cancer, but is there a particular way that alcohol affects oral cancer or oral health, or is it a byfactor of the fact that alcohol is a toxin to the body?
It's a toxin to the body. It changes smoking changes the genetic makeup. It changes your ability to heal properly. It's everything. Alcohol affects your liver, and your liver is helping you, replenish and refresh your cells. And if it's damaged, you're just body's not going to function. So alcohol, everything in moderation, nothing should be so excessive. And, but yeah, alcohol affects the whole body in many ways. And I think during COVID, liquor stores were considered essential. Dentists were not considered essentials, but liquor stores were. Can you believe that?
How flipped is our thought
Right.
process? That's crazy.
So if you broken tooth, just drink the brandy and forget about it. Don't worry.
What a terrible message, right?
Oh my, yes.
Well, a bunch of people asked the question about that, so thank you for sharing. Also, we have a question from Jenny. Are orthodontists screening teens for this?
I don't think so. There's usually the dentist that is screening for that. Orthodontists are doing different types of checks, right? Like when I see teens, I'm looking for their bite. I'm also asking, even for young children, I'm asking, are they snoring? Are they grinding their teeth? How are they sleeping at night? I'm looking also at their adenoids, if they're closed or not. And that's something the orthodontist will be looking for. They're not necessarily screening for oral cancer. They're screening for airway issues. They're screening for if the tonsil needs to be removed, that comes into airway, if they have a collapsed palate, if they have bite discrepancies, crowding, spacing, impacted teeth. So dentists and orthodontists conjunctively work together on those factors, and I make the appropriate referrals. But when you're the orthodontist, they're not screening for cancer. They're screening for all this their specialty work. But they may see something. Yeah. But they may see something and say, hey, just get it checked out, maybe especially in an older patient, not necessarily a teen.
Mm-hmm. All right. Yeah. Well, that's very important to make sure that you're taking your children to the dentist as well on a regular basis, and that you are asking. I love the fact that you have a family dental practice, because you can kind of all go in and discuss the same kind of care, because it's, no one is
potential. And I see, the 3 generations, especially on Saturdays when the whole family and they all come, and I'll see, the granddaughter and the mom and the grandmother, all of them. And it really is. It's not only is it family dentistry, but I also work with very few like I have a orthodontist that I work with, an oral surgeon that I love, an endodontist, and we talk about cases, and it's an open, honest conversation going back and forth between the patient cares. It's not like when I refer to somebody and it's like, okay, that's your patient now. No, it comes back and forth. It'll be something they can't treat. My periodontist will refer back to me and say, hey, can you take care of this? And I'll address it. Just like a case of an orthodontist, even though you're getting braces or you may have retainers that are removable, you still got to come and get your teeth clean, especially with braces. It's food gets stuck and trapped and it needs to be removed. And you may develop a cavity, and then the orthodontist will send it back to me, restore it, and then go back, so it's a back and forth. And that's what you need. You need a community of dentists working together.
Yeah. Yeah, no, that's really important. Everyone has their piece, but all together is the best bit of information. Also, I think, when you talked about 3 generations, it really speaks to the importance of knowing family history, right? Because that's a very important piece in you taking a look at potential oral cancer and other oral issues. Genetics has such a big part
Genetic and
in things.
absolutely, and access to care. A lot of my patients, will tell me, like I had this gentleman yesterday. He's like, "Oh, you changed my perception of the dentist because I hated my dentist when it was in a different country, and it was painful. He's like, you've changed, and now I want to take care of my teeth." And I'll hear people also say, "I don't need to take care of it. My teeth are going to fall out." That's what happened to my mom. She lost all her teeth by 50. But no, that's not true. It's, yes, genetics plays a component, but how you take care of your health and what kind of care access you have. Are you going to the dentist every 6 months? Are you treating that small cavity with a filling rather than waiting for it to become a root canal? So it's a bunch of factors, and not necessarily did your parents lose their teeth early necessarily mean you're going to lose them. That's not true. It's and like you said, you know better, and you're going to do better.
Right,
Do
exactly.
better for yourself and for your children.
Yeah. So we're all gonna do after today. So
Mhm.
Anja has a question: is it snoring a sign that someone may be a candidate for oral cancer?
Not necessarily oral cancer, but if you are snoring, you should not be snoring. Snoring may be a sign for sleep apnea. So snoring can be for many reasons. It could be, a septum issue. It could be that you have a smaller arch of the top of your mouth, so the maxilla. So think of the roof of your mouth is the base of your nose, if you want to think of it that way. And so if you have a very small palate, you have a constricted palate, and you have a very small base of your nose, and you're not getting good airway. It could be your enlarged tonsils. It could be a host of other reasons. But if snoring and you're grinding, and not necessarily do you have to be heavy set with snoring, but snoring is a sign of sleep apnea or some sort of a constructive sleep and airway issue, and that needs to be evaluated by either an ENT can take a look at you, or you can come into the office, we'll screen you and then make the appropriate suggestions where you need to go. But pulmonologists can screen you as well. So snoring is not good.
Well, this is what's so wonderful is that, you have so much knowledge and the importance of asking the questions. And that's what you gave everyone an opportunity to do today. And I am so grateful for your being here and sharing this information, really enlightening us all on the importance of a dentist, how important it is with what dentist you choose, and to be thinking about things beyond a cavity, and that going to take care of your oral health is about your overall health and critical in keeping you healthy. So Absolutely. Thank you so much for that, Dr. Makar. We're going, as I shared, we're going to send you all links to the book that is so inspirational, as well as contact information for Dr. Makar, so that if you have questions, you want to come in to see her, you want her to assist you in any way, she can do that. I encourage you to. Also, as I shared, this is being recorded. You will get a version of this so you can share it with your community. Let's get the word out. Let's get the word out about oral care, how critical it is. And thank you, Dr. Makar, for being a shining light on a very important topic.
Thank you. Yeah.
Thank you all for joining us this morning. And I wish you all a very wonderful rest of your day and look forward to seeing you on a future webinar. Have a great day, everyone. Bye-bye.
Bye-bye. Thank you so much.
Thank you.